Hi, today I want to talk to you about gestational diabetes and shoulder dystocia. Gestational diabetes is when a mother is pregnant and her glucose levels, or her sugar in the blood, becomes elevated. It increases. What ends up happening is the elevated glucose levels start to rise also in the baby. The glucose goes through the placenta and the baby then receives that increased blood sugar as well. What that does is trigger the baby's pancreas to create more insulin in order to balance out the glucose levels in the baby's blood. Higher insulin, however, is problematic, and the reason being is because insulin is a human growth hormone. It increases the size of a child. Usually it's not the end of the world. Your baby may come out a little bit bigger than normal. However, it does pose a problem with shoulder dystocia. Shoulder dystocia is when your child gets stuck in the birth canal right behind the pubic bone as he or she is getting delivered. Shoulder dystocia can be extremely dangerous for a couple of reasons. First of all, it can be dangerous because it can compress the umbilical cord and the baby may not be able to receive oxygen. A lot of people think that because the baby's head is already outside of the birth canal that it can start breathing, but that's not necessarily the case. In addition, it could be dangerous because the doctor may have to use force, and sometimes uses excessive force, to pull the baby out of the birth canal. That can cause nerve injuries here in the brachial plexus area and may impair the baby later on with shoulder or arm problems. Gestational diabetes is not a death sentence. It is not the end of the world for your child either. However, it is extremely important for your obstetrician to be tracking the fact that you have gestational diabetes. Your obstetrician should be tracking the weight and size of your baby and making a decision before you even get into labor as to what you will do. It could be that your baby is so large that a C-section is going to be scheduled in order to take the baby out so that shoulder dystocia does not come into play whatsoever. If you have questions about gestational diabetes and shoulder dystocia, please give me a call. My name is Adam Funk and I am a birth injury lawyer.